1 p.m. or around it. The attendants of Mrs. Nicole Smith found her collapsed and unconscious. She apparently had been sick for several days, which was approximately some kind of stomach flu. And one of the individual who was her bodyguard provided resuscitation. Medics came to the scene, and the body was transferred to the hospital. At the hospital, unfortunately, the patient was virtually dead on arrival and was declared dead around 2:40 or so in the afternoon. According to the Florida statute, the Broward County Medical Examiner assumed jurisdiction because this is clearly a sudden, unexpected, and unexplained death. And according to that, myself and one of our associate medical examiners, Dr. Just, performed with an autopsy which we just completed several moments ago. The autopsy was able to exclude any kind of physical injury such as blunt force trauma, gunshot wound, stab wounds, or asphyxia as a cause of death, as a contributory cause of death, or a hastening cause of death. The only thing which we found in terms of very minor trauma was minor bruise on the back, which was related apparently to a fall reported to have occurred several days ago while the Mrs. Smith was in the bathroom. The autopsy revealed only subtle findings in the heart and in the gastrointestinal system, in other words, in the intestines, which would have to be verified microscopically. The other finding which we found was a small amount of blood in the stomach, which is related to her being in terminal shock short time before she died. At this time, we do not make a determination of the cause and the manner of death, and basically we have a long list of investigation procedures which have to be completed and include an extensive review of the medical records, interview the witnesses which were with Mrs. Smith or witnessed her collapse, further cardiovascular examination of the heart, and neuropathological examination of the brain and the spinal cord, bacterial and viral studies of heart, intestines, and a variety of other tissues, chemical analysis of the eye fluid, and an extensive microscopic examination of the body tissue which were taken for examination. Now, it's our estimate that collecting the information and putting it together and relating the clinical, pathological, and laboratory data would take approximately somewhere between 3 and 5 weeks. The medical examiner's office is obviously aware of the significant public interest in this death, and therefore we are prepared to make optimal efforts to expedite the determination of the cause and manner of death without affecting the thoroughness and the reliability of our investigation. So now, if you have any question, either addressed to the chief or to one moment. I am not able to answer to a chorus of questions. So we have from the sheriff's office.
Is there any indication that she may have taken a large amount of the prescription drugs that were in the room, and what were those drugs?
There is no such indication because we didn't find any kind of pills in the stomach. If this would be the case, and there would have been a large amount, we would have seen that. However, at this time, we don't have the results of the chemical test, of the toxicological test, and that's why this determination of the cause and manner of death is postponed until the entire pieces of the puzzle. That's a medical puzzle which will have to resolve, have to be placed in place, so we get a comprehensive picture of what exactly happened.
What kind of drugs?
Right here.
Okay, go ahead. What?
Ruled out drugs at all?
Rule out what?
Have you ruled out drugs?
No, I didn't rule it. I think I was very clear. What I said is that as part of our investigation, we'll make a very comprehensive and thorough examination of a variety of drugs and medication which he probably took. We have a list of the medication which apparently were in the room, but a list of medication doesn't mean that those medication would be found in the person. So we did not exclude any kind of contribution of medication to the death, and this will have to wait the results of the toxicological study.
Right here in front.
Yes. It's a possibility that it might be a natural. At this time, I cannot make a determination because there are a number of possibilities. Basically, there are three major possibilities. One is that the death is due solely to natural causes. The other possibility is that the death might be due to some medication or chemicals. And the third possibility is that there's a combination of natural causes and medication, and at this time we do not have the results of the test which would permit us to make this determination.
Dr. Purper, you said there was subtle findings. You found subtle findings in the heart and gastrointestinal that need further examination. But what could those findings be an indication of?
Well, sometimes findings, very subtle findings in the heart can be an indication of an inflammatory process in the heart which is not visible by the naked eye. That's why I'm not saying that I make this diagnosis, but I see something which looks a little bit unusual, and on microscopic examination this may verify a significant process, or it may be nothing.